Before we start our episode today, I wanted to let you know that it's March, and in the spirit of this month, Dr. Kuba and I have gone mad. We have actually added a whole new section to our monthly digest, which you can get through becoming a subscriber. We have added a section called Sweet Sally's Solutions, and this is meant for your team to help you digest the digest. So there's a whole section of tips and actions for them to take. You do not want to miss this. This is a super practical section of the digest. I know it's going to be super helpful for everybody. So don't hesitate. Click the subscribe button in the show notes below and become a member. We can't wait to have you join.
Hey, friend.
Hey.
So I want to talk about today, because I was asking you the other day, like what's been going on in your world, what kind of things are you dealing with, and you mentioned an example, and I thought this was super helpful because I feel like I've come a long way. I used to really suck at this, and it's a reminder that I have come a long way, but it's always a good reminder. Like when you were talking about it, I was like, ooh, I need to remember that, or I need to do this, which then begs the question, the next step is like, but when and how? And that seems so tedious, and it's just easier not to do it. And then you reminding me like the benefits of doing it. So
yeah.
You mentioned that you had a client where one of his key employees moved. Mm-hmm. And so now they have a replacement employee, and 2 months in, kind of the things that are happening in that practice and what you advise them. So I think there's a lot of important nuggets there. So I may have you start with, if you don't mind, like when you said key employee, what does that mean? Why were they key? Have they just been there a long time? What tasks were they doing? Like what made them key?
That's a great starting point. So I've actually got 3 different scenarios. So the one I was talking to you about, she was key in that she was a very productive individual of the team. And
front or back?
Technically treatment coordinator. So both, I would say. I don't know. She was seeing new patients. She was treatment planning. She was responsible for getting the patient to move forward with their treatment. She was making all the financial arrangements. So when I say productive, a lot of the practice success ended up relying on her shoulders.
So the case acceptance that is critical, and most of us
critical.
Like, struggle with that.
And just that initial first patient impression, she was really good at making that a positive, energetic type appointment. Lots of personal connection that was developed there. So she was just, it was a key role for the success of the practice, but also she was good at
How long had
it.
she been in the role?
A few years.
Okay.
So 3 years or so.
So she knew the practice well. She knew the patient. Gosh, that is...
Yeah.
Ooh, my stomach's feeling queasy just thinking about like the heartache for that doc. That sucks.
It was a definite loss for the practice, and a hard skill set. Like you're looking for a very skilled person to fulfill that role. So very difficult person to lose. The second scenario was one that had been with the practice for many, many years. And she is just a gem of an employee. She was so familiar with all aspects of the practice. Through the years, she had become that person that she started as an RDA, but then she could step in at the front and she could do every single role at the front, from insurance to check-in to collections. When the office manager went out on maternity leave, she stepped in and could fulfill every aspect of that role. She's just smart, a go-getter.
Where did she go? What happened?
Her husband, his job got moved.
Okay, so 2 moves.
Yeah.
That sucks.
Yep.
Okay.
So we lost her, and she was a really hard one to lose because she was just the jack of all trades. Like wherever she was needed, she could go. She could be fulfilling a role at the front one day, and Doc's like, hey, I need to get some sealants on this little kiddo. Can you come back and do these sealants real fast? Absolutely. She'd hop back, do the sealants, get back to her role at the front. Very difficult position to to replace because she's skilled, and longevity in the practice. So that was another one that was lost.
Stupid husband.
I know, these dang husbands and their job changes.
God.
And then one team member was actually, it's unique. It's different from these other two in that it's a critical role because it's a small startup practice and there's only 2 people on the team. So you've got your kind of person at the front that's got her domain, and then you've got your one RDA and her domain. And so when we lost this particular team member, finding a replacement was critical because it's like you don't have any backups. There's nobody to cover your mistakes. So you've got to be good from day one. You've got to step in and kind of own this domain. So all 3 of those, to me, are scenarios that the person was valuable for different reasons.
So I guess pick one and go, like the one you mentioned to me, like the one that now...
Which was the TC.
The treatment coordinator. Okay. And so now they have a replacement there that's been there for 2 months. So what, I guess my question would be, what did they, what was the screening? Because again, it sounds like that's a unicorn, right? Like it's somebody who clearly, even if they found somebody else who had, 3 years or more of being a TC in another practice, assuming you can afford said person and that they live in your, near your office and that they can match the hours and all of those mind-numbing logistics. So here they are in the office. You've settled on this person. How did they settle on that person?
So it was a rigorous screening process because we were looking for a certain personality type that we knew could connect with patients and parents. So communication skills in this particular role are critical. So we could tell in some of our phone screenings if the person had, to me, phone communication is way more difficult than in-person communication. So if you can have a good presence over the phone and impress us over the phone, then there's a pretty good chance that you can impress us in person as well. So communication was one of the key things that we were looking for in the phone screening process, and then experience. We knew a new person stepping into that role, it's too big of a responsibility to put somebody that's new to the dental field in that role and expect them to be able to perform when they're absorbing like dental lingo and what does this even mean. That was going to be way too much. So we needed experience, and then we needed somebody that had really good communication skills. And ideally we wanted somebody that was a little bit more mature, because we have found that when you're talking big case presentation, a 23-year-old is going to look at a $6,000 treatment plan way differently than somebody that's been through life and finances and all of that. So our preference was to have somebody that maybe had a little bit more maturity to them. So we did end up finding that candidate, and I think she was the exact right choice. But we're sitting here a couple months in, and we want, when somebody is coming in to fulfill a very important role, we want them to kind of get their feet wet. We want them to get a feel. We want them to be able to get in their zone, so to speak, without a lot of like, you're doing that wrong. You're doing that wrong. Nope, we don't do it this way. There's got to be a little bit of a runway for them to get their feet under them. So that's really what we've done for a couple of months. She was brought on. She was trained by, in this particular practice, the doctor's wife has always been the backup TC. She's not in the office on a regular basis. But if the TC had to be out, then the doctor's wife could step in and fulfill that role. So in this particular case, the doctor's wife has kind of been demonstrating like, this is how we do it. So good onboarding process, and then turning her loose to go, okay, great. You've got this, take it and run with it. Well, in the take it and run with it process, there's been like, hey, there's probably some changes that need to be made. We don't quite do the patient experience like this. We don't do a lot of educating before the doctor comes in, because then we're wasting time. We educate after the doctor comes in, depending upon what he recommends. And so just nuances like that need to be corrected, but it's also like, how do we approach that with the candidate? So the doctor and I were just talking about this recently, and it's like, we've got to be clear. We're doing the new employee no favors if we beat around the bush with the feedback. And I have found that most really qualified people that step into the role, they want feedback. They want to know how they're doing. I think oftentimes from the owner side of things or from the manager side of things, we're like, I bet she doesn't want to hear that this needs to change. But I think we're wrong in that assumption.
So I'm gonna say I agree with that, but I think more than anything, like if it's me, I'm like, this is uncomfortable.
Yes.
And then am I clear on why what you just did was not appropriate, and can I articulate that appropriately without, I think a lot of times I'm like, okay, but if I say don't wait on, or you need to wait on me to come do the check before you educate, but that may not be true in all cases. Mm-hmm. So is it a blanket enough statement? Like, do I have enough to go? Because then is it going to go in the opposite direction? Because now I'm going to walk in the room and the patient, we're starting at a point where I'm like, wait, we're not teed up for me to come in. Well, you're the one who said don't XYZ. So,
right.
So have I made it clear in my mind? And even just the thought of doing that, I'm like, I'm already tired. Mm-hmm. Never mind.
I know.
We'll figure it out. Somebody will tell her. And it's absolutely the wrong mindset, which is why I wanted to talk about this, because I think from my side, I don't want to ruffle feathers, especially in somebody that's so new, that we've already spent some time training. And I think for me, I'm still trying to figure out your personality. So how should I approach you? Without offending you and it being a productive conversation. I think there's also like, what is your ceiling? Like, I don't want to insult you if I'm saying something. So I think just the thought of all of that makes me go, never mind. I'm just going to hide in my office and Sweet Sally will figure it out. And which is a stupid thing to say, like looking at it from that perspective, going, well, how would Sweet Sally figure it out then?
Right.
How would she?
Right.
But I think for me, because it's so uncomfortable and there's so much thought process, that I was just like, you know what? I'll think about that. I'm going to get back to my clinical note. Okay, now you need me over here. Now you need me over there. By the time it's said and done, you go home and you're like, oh yeah, I was supposed to talk to Sweet Sally about this. You know what? I'll talk to you about her tomorrow. But when tomorrow am I doing this? So I think that's why I wanted to talk to you about this, because when you mentioned that, I was like, it was a good reminder for me, because we're in the same boat with one of our assistants that's been there 2 months now. And I think for me, I'm like, I'm still trying to figure out her ceiling, because she's done well with a lot of things. Like, we haven't had to go back and say your x-rays stink, or you put this in the sterilizer that you shouldn't have, or we haven't had those issues. But she's going to have a ceiling, and it's like, am I doing my due diligence to make sure that we are communicating with her? And I'm betting the answer is no, because I'm sure I'm not doing my due diligence, because I can't remember the last time I had a conversation with her. So then who is having the conversation with her? Is it my clinical team leads or what? And I'm literally like burying my head in the sand right now, because I'm like, somebody's got it.
Yeah.
And that's what, when you said that resonated with me, because I'm like, does somebody got it? Like, I don't know.
Who's got it?
Yeah, who's got it, and what have they got? Like, where are we with this? And so I think that's where I was like, okay, going back to like, do we have a checklist or a system of, you said the doctor's wife kind of trained her, but I don't have a doctor's wife in my practice, so then who trained her? You know, like, I think... I don't think we've been super organized with it. Now, we've gotten lucky, because she seems to be a young lady that we could tell from the get-go was very much a team player. Just her personality seems very calm. She doesn't seem ruffled by a lot of things. So we're like, and just honestly, just given her age, she's the youngest one there. So I think she already assumes that the big sisses in the office are going to kind of tell her what to do and what not to do. But honestly, the one she replaced was also the youngest one in the office, and she did not like anybody telling her what she did wrong. And, she did do no wrong, right? Like, so I think in this case, we've gotten lucky. But when you said that to me, I was like, oh man, I can't just... I probably need to make sure that there's a system for what we're doing. And I'm like, I can't think of our system right now, other than I think she's still learning from just being there and being thrown in. Yeah. But how far is that going to take me, I guess?
Well, and I would say that's step number one when we're onboarding a new person is we've really got to have a good onboarding system. And so I feel like this is one of those areas where offices don't have a good system. I think back, as you were talking about onboarding, when I was doing my master's program here in Texas, my husband and I both worked at an insurance agency. So we were insurance brokers is what we were called. And we
learned something new about you.
I know.
Look at this.
It was I learned so much in that job. I was in the call center. So I would take calls in when somebody had an accident, they would call in and I was...
You were the bad guy.
Yeah, I was taking all the detailed information. But I think about that experience, and we had a week-long onboarding process where every day we were sitting in this seminar and learning things about the business, about the task, about... and I use that as an example a lot because I'm like, if an insurance call center can have that type of in-depth onboarding process, it's interesting to me that in a medical environment or a dental environment that we don't have a good onboarding process. We're like, hey, jump on in there, watch us, you'll figure it out. To me, I go with it needs to be a balance of both. Yes, they've got to get in, they've got to get their feet wet, but also we've got to set clear expectations about what do we want them to learn in this first week? What do we want them to learn in the second week? How are they doing with progressing with those things from week 1 and week 2? So you don't know this, but your lead assistant, she has that document. She's been using it for your new employee, by the way.
Oh, thank goodness.
Yeah.
Okay, good.
So she's got a very clear onboarding plan. Now, how detailed that plan is, I think some are better at executing that onboarding plan than others. But, just to kind of throw in, that will be part of the March Digest. So you need to, if you want a good onboarding outline, you need to sign up for the digest because you'll have that available to you.
Which is where for me, I'm like, why are we always reinventing the wheel on this? Like, why have I not had a list?
Yeah.
Because I know at one point when we did have an office manager, she had created the list. And I remember thinking it was a good one. I guess the good news is we don't have that much turnover that we would need that
right
every time. Like the one that's replaced now, like the other one had been there for 2 years. So like we haven't done it in 2 years.
Yeah.
But good. I'm glad that we did have a system and we're not reinventing the wheel. I've just forgotten it. Okay.
Yeah. But most offices don't have that. Most offices are, let's do a little bit of talking about the role. Let's throw her in. Let's kind of give her like daily, oh, we do the x-rays this way, or, oh, we do height and weight before we seat them, or whatever the case may be. Those little nuances come up, but a lot of times the big picture stuff doesn't come up. So step number 1 is we've got to have a really clear outline. And in that outline, it needs to force conversations of feedback. Because to me, it's one thing to be like, 90 days in and you're like, oh, sweet Sally, gosh, come on in. Now we've got all this feedback from the last 90 days. And Sally's like, I would have loved to known about this 2 months ago when I was doing it wrong. And so it can feel like a tense conversation or the kind of conversation you want to avoid because it's awkward. We're like, you've been doing stuff wrong and we're just now telling you about it. So the onboarding process should force feedback, and they should know from the beginning, by the way, we're going to go through this onboarding process. This is the outline that we're going to follow. You'll see at 30 days, we'll have a review with you. We believe in very clear feedback, so you're going to get some really clear feedback from us. We're telling her about that before we sit down with her. At 60 days, we're going to sit down and blah, blah, blah. Because then it's like, now I've told you, I've got to follow through because I committed to you that I was going to give you feedback. So it puts the pressure on me to hold me accountable. But I'd also tell Sweet Sally, like, this is coming for you. And then she's ready for that feedback when the time comes. So the system has got to be really clear.
I would say even like one thing that I probably should have been doing, and I think, I'll tell you why I don't think I have, but it still doesn't make it right. But I think maybe when we hire, we should put in our Indentrix, like Sally's 30 days.
Yeah.
Check in with Sally, and like put those reminders on the schedule for you, because a lot of times time flies. We can't even remember how long that person's been there.
Yeah.
Unless they're a complete pain in the ass, then you probably remember going, God, this person's been driving me crazy, which at that point too, how are you getting that person out of the practice?
Right.
But typically we hired you for a reason.
Yeah.
We went through a hiring thing, and we don't want to, unless you were the only candidate.
Right.
I think the reason I haven't done that so far is because you come in every month.
Yes.
And I'm just like, hey, Bethany, can you check in with Sally and see how things are going?
Yeah.
Which is good because you kind of do a big picture, but it's not good if we have specifics that we've not shared with you. So
Right.
we try to get better on going, well, Sally, did this, and this is why we didn't like it. So I think the other part of that is, maybe those 30, 60, 90-day check-ins are good for bigger picture stuff. Just to see, like, are you still aligning with our practice philosophy? Did you, when this patient said this and you saw that we handled it this way, tell me your thoughts on that. And
Yes.
But I think it's also important, like, to as you're seeing mistakes,
Yeah.
correcting them
Yes.
then.
In the moment, and setting the stage that that's going to happen.
Yeah.
Like, hey, we want you to be successful, and we found that the best way to do that is in the moment. If we see something that needs to be tweaked or changed, either right then or right after that patient appointment, we'll have just like a quick 30-second conversation. Those are never meant to be offensive. Those are just meant to be clear.
And I think tagging in your team and saying it's most likely probably not going to be me. It'll be one of your teammates. So that way she doesn't think the team is picking on her. Like,
right.
we're trying to look out for your success so that you can stay a team.
Exactly.
And so I think those are, again, that's where I think for me, where I'm like, so the other day, for example, we had one where, it was a 2-year-old, 4 front teeth rotted out, first mold, like the typical pattern of baby bottle decay. And so this kid was going to need IV sedation and whatever. And as I'm trying to treatment plan it, the mom and the baby are in the room, baby's still crying because we just finished the exam. Mom's trying to ask me questions. I can't think because the baby's screaming. We're all like trapped in this little room. And my thought is, get this family out of here, assistant. Like, what are you doing? So I'm like, why don't you let them go play? I think once baby gets out of this exam room and is in the game room, they may calm down. So why don't you escort them there? Mom, don't leave. We're going to finish having this conversation with you about our plan, but let's just get to baby's calm. I know you're having a tough time wrangling baby right now.
Yeah.
So that's my hint, like, move on, like, so we can keep going. So assistant comes back and she goes, okay, so is this going to be a same day? And I thought, what on God's green earth would make you think that I would be able to do this IV case same day? Like, what? That was a weird comment. And then I thought about it and I was like, you know what? Actually, she did that to me 2 days ago. There was another kid that wasn't an IV case, but the kid was clearly struggling. Like, the whole appointment was a struggle bus appointment, and we had to do, I don't know, a couple of fillings or a crown or whatever. Okay, is this going to be same day? And that was my first time.
Yeah.
Where I was like, what would make you think that I could get this done same day?
Right.
But then I was like, okay, don't be a bee. Like, she's new to the practice. She doesn't know.
Yeah.
Like, she hasn't put 2 and 2 together yet. She's not assisted as an op. Like, honestly, I still think it was a dumb comment, but I'm just kind of like, okay, I don't know who else has said what to her. Maybe there were others that she didn't think could be same day, and then we're like, same day, and she's like, what? You're going to do that same day? So who knows? But to me at that point, because I knew I probably wouldn't say it super nice, like, my thing would come out and be like, well, why would you think that would be the same day? Like, I knew that that's how I would approach it. So I was like, okay, punt, you shouldn't be the one to talk about that. But before I forgot, I emailed my team lead and was like, hey, she asked me this on this patient and this patient. So the team lead could know. So when she goes back and looks at it herself, would be like, that's weird. Why would she think this? In any case, but I was like, somebody coach her on this, so she kind of has a better idea. Because what I would hate to do is if the mom then is like, oh yeah, can we get this done today? Yeah, I think, well, maybe, let me go ask. Oh, honey, you've just set the expectation completely the wrong way. Why would you do that?
Yeah.
And even like we had one the other day there was a lot of confusion where initially the mom said yes, she wanted same day. So the front who went over the estimate with her announced that on our headsets, okay, we do want same day. So now the assistant is getting the room ready, the patient's sitting out in the front, and it wasn't until the mom, I can't remember, she went to sign the consent, and something about the consent form, I guess, made her go, wait a minute, do I really want to do this today? I still don't have the answer to that, but there was so much confusion in the back because now we still had X number more patients to see. We're thinking assistant, Amy is going to now be with the same day. And now we're trying to figure out who's going to see the rest of these patients and all of that. And and it turns out that in the end we weren't doing same day. All of that to say, if this assistant is now going forward with, like, we might do same day, and she's communicating that to her teammates, and the teammates are now confused, like, we needed to have a conversation about it.
Yeah.
And so reminding my clinical team, so somebody needs to have the conversation.
Yeah.
Either that's going to be me, when I can get my brain around how I'm going to word, why the hell would you think that? Like, I need a minute to think about how to rephrase this. Or I could just punt it to somebody where they could sit and have more time with her another day and say, tell me why you thought it was same day. Yeah. Here's how we do same day. So, like, I sent an email to be the reminder to finish up on that point. So I guess that's my point here. If you don't have time or you don't know how to do it properly or whatever, like, try to think of ways you could come back and say, hey, Sally, we're going to talk about, a couple of these patients. You two, please have your questions ready, know, in these last 3 days where we've been super busy. I want you to go through the schedule and see if there were patients that you were confused on or that we could have communicated better with. You bring yours, we're going to bring ours.
Yes, where it feels collaborative. Like, hey, we've got certainly a list of feedback that we need to give our new team member, but also to encourage her to bring her questions to the conversation as well, so that it feels like, hey, this is all in an effort to help the person be successful. And that needs to be the tone of it. It doesn't need to be a hazing type feeling where, hey, you're new to the team, we're going to beat you up, get ready for it. That doesn't need to be the tone at all. That team member needs to know we're working together to help you get as successful as we can get you, as fast as we can get you. And I do think you can set that tone appropriately in these conversations. Part of it, of course, is having the good laid out plan, but part of it is how are we bringing up these corrections? Who's bringing them up? Is the right person bringing them up? Like you were saying, you knowing in yourself, this is not going to come out the right way. So let me pause on that, and who can I tag in that would bring it up in the right way? I think also making sure that whoever's delivering the feedback is clear. I feel like oftentimes when we give feedback, in order to make it feel like it's not a stinging feedback, we soften it beyond the point of recognition. So then it's like, we might be fluffing them up so much with, oh, you do this so well, you do this so well, you do this so well. You need to change this one little thing. I get why you do it this way, but we really need you to do this instead. You get that? And then we move right back to...
That sounds like you're describing me.
Well, I mean, didn't think I was describing you, but we're not... Yes, we can encourage them. I want these to be encouraging meetings, but sometimes we can be so overly encouraging.
Overly sugarcoat.
Yes. So get to the point. Have clear examples that you can provide. Sometimes even same day examples. Like if hey, I'm having a conversation with Sally at the end of the day, and she's been asking this same day question, which is odd. Let me see if she asks that at an odd spot today, so that the example that I give is the freshest possible example that I can give, so that she's like, oh, I see what you mean, because I did ask that today on little Johnny. So making sure you're coming in with clear examples, because sometimes we're either too sugarcoaty or we're saying conceptually you need to do better at this.
We're too vague. Yeah.
And she's like, I don't even know what they're talking about. What does that even mean? And we're shying away from the examples because we're like, oh, that's going to be too direct. And we're not direct enough.
I think having the examples is so critical, because I think for the most part, every time I've done it that way, it doesn't seem like an attack.
Yes.
Because it's relatively objective. But then I start seeing like all the subjective, like clearly this is what I thought, but you thought about it different. And oftentimes they're not wrong.
Yeah.
And I'm like, oh, I could see why you said that because of XYZ. So it's eye-opening for both parties, honestly, a lot of times. And so I think just getting used to getting comfortable with doing that, or just knowing that that's what's got to happen if you want this to be a successful onboarding and retention of this employee.
Mm-hmm. And I like too that you mentioned the collaboration in that conversation, because when we come to these scheduled meetings, whether that's once a week, whether that's every 30 days, So we've got the daily feedback that they're getting, like during patient care, but then we've got these kind of moments where we sit down and process the feedback a little bit more deeply. I think when we have a collaboration type feel, hey, we actually only offer same day under these criterias. I noticed today that you were wondering if we would do same day on little Johnny. Tell me your thought process on that. Why did you think he was a good candidate for, and it's not done in a, why did you even think that was it's done in a, I'd be curious to hear your thoughts on that. I feel like I can always learn something new from your observations. You mentioned that he might be a good candidate for same day. What was your thought process on that? So when we can have more of a collaborative type conversation, this feedback is usually well received. When it doesn't feel like we're attacking them, it feels fair that we are giving the benefit of the doubt in situations, and when it feels like it's a dialogue rather than a, come here, sit down, I'm going to throw a bunch of things that you're doing wrong, now go fix them. Well, that's not going to be received well, and that can be defeating. So be clear, but also be collaborative in the conversation, and it should always be shrouded in respect.
And what I like about that is, because I think for me, when you take the time to do that, you're helping them form a thought process rather than just following a checklist. And following the checklist is important too, but what I always say, in my office, I'm like, the checklist will get you 80% there. But what about the 20% that doesn't line up with that? Because a lot of times what happens in these conversations is when I'm like, oh, well, why did you this? Well, because you said that the criteria was this, this, this. And I'm like, yep, in this one it is. But there's actually an additional point over here. And they're like, well, that's not fair. Like, I went through the criteria. Yeah, but I'm also looking for somebody who can think.
Yeah.
And so common sense would tell you that even though those criteria are met, this is going to be an outlying factor. And so if you don't spend time helping your employees critically think, you're always going to end up frustrated at some point. I think we talked about a colleague of mine a few episodes ago that I don't think she's ever trained her staff to critically think.
Right.
And she's burnt out because all the thought comes through her.
Yeah.
And now where she's getting hit by life, and she doesn't have a support system because she's always been the one to swoop in with the answer. And I'm like, yeah, I mean, not everybody's going to be suited to answering this all the time, but if you've never, so these conversations allow you to see how the person thinks, and they can see how you think. And that can go a long way in even you realizing and going, oh gosh, that's how that person thinks. Well, that person's never going to be the one to talk about it.
Yeah.
That's her ceiling on this. Where else is she going to do well? Or, okay, I like the way she thinks. That does kind of make sense why you suggested that, even though it wasn't accurate in this case, but I like that you were thinking that, maybe this is the person that I can tag in for these types of things because she has shown the ability to think.
Yeah.
So it's really illuminating on a lot of those things that if you don't take the time to have these corrective conversations, like the first thing is, yeah, you're going to have an employee that has no feedback, is going to get frustrated when they're hit with it at the 6-month mark and go, why has nobody told me this? But it's also, you've not been able to test the limits of their ceiling.
Yes. Yeah. Exactly. You do not have a perspective on this person other than what you just see in the direct patient care, but you haven't gotten into their head and seen their thought process or their ceiling, to your point. So these conversations can be very illuminating for the new employee because they're getting feedback, they're understanding your mindset on things, which helps them to calibrate more quickly. And also you're figuring out how much they can accelerate or where they might be a good fit based on their thought process. So to me, these are win-win conversations that we genuinely avoid because we're uncomfortable with them. I just don't think they have to be uncomfortable. I think if we set the stage that this is a normal part of our onboarding process, then the employee is prepared for it. We're holding ourselves accountable. And then when we get into the conversations, when they're very clear, but they're also collaborative and respectful, they can be even far more illuminating to both sides of the party.
And the other thing I would say on that is, okay, let's say it is uncomfortable and you do it and Sweet Sally has a meltdown or is very defensive or is very not open. Well, wouldn't you rather know that at the 2-month mark and be like, bye, honey, like this is not going to work long term?
100%.
I'm not going to tippy toe in my own house around you. So if you can't take feedback, then bye.
Yeah.
You know, and yes, that's heartbreaking, scary, because you're like, well, I picked you for a reason. There were only 2 candidates that applied, or whatever. But would you? I would rather have the weeded out sooner than ruining my garden for longer.
If feedback is going to be difficult at 2 months in, when the employee should be expecting feedback, then it's going to be insanely difficult at 2, 3, 4 years in. So absolutely cut the weed early.
And I'm just thinking about ones in my recent 1-year history. I think those were things that's exactly what I was doing. I was coddling people along because I didn't want to have those conversations. I assumed that their longevity in the practices that they were in would get them there faster. And so I should have, looking back on it, they should have been gone at month 2.
Yeah.
And saved us the heartache of one, lasting 11 months and how awful that 11 months was. And then the other one, 2 years. And so I just think like that I should have heeded this advice, although I don't think I had this advice. Now I do. But like at the 2-month mark, when we're struggling to get you to not be defensive, I should have gotten rid of you at 2 months.
Yeah, that's a problem. Well, I will say it's an important topic. We're going to have resources in the digest to help you build an onboarding plan, feedback forms, all of that. So this is a starting point, but there needs to be some homework done to get prepared for these conversations. So
I love it.
Thanks for chatting with me about it today.
Thanks for joining the conversation today. We hope that you are comforted in knowing that you are not alone, but we also hope that you're walking away with some really great tips and tricks to try in your practice. We value your feedback, so please take a few moments to rate and review the podcast. Finally, we want to make sure that we're covering the topics that matter to you. So track us down on Facebook, Instagram, and Twitter, and let us know what topics you want us to cover. As always, please know that we are rooting for you today as you manage your dental drama.